Welcome to a place where you'll leave feeling whole. The Counseling Podcast brings at-home counseling right to you, focusing on self-care, self-expression, and breaking down barriers. Dr. Jaclyn and Dr. Stokes bring over 20 years of combined experience and a new sense of style to the word counseling. The two use humor and lighthearted conversation to explore these deeper feelings. Let's take the stigma away from counseling together.
Hello and welcome to the Counseling Podcast. I am Dr. Jaclyn. Today we have a special guest, Ekiba Smith, and she's going to share information on EMDR therapy. So Ekiba, would you like to introduce yourself?
Yes. So my name is Ekiba Smith. I'm a licensed mental health counselor located here in Central Florida, and I am also an EMDR trained therapist.
Great. So for our listeners, can you tell us what EMDR is?
Okay. So EMDR stands for eye movement, desensitization, and reprocessing. Sometimes it's mistaken for hypnosis, but that's not what it is at all, by all means. EMDR mostly focus on individuals who might have experienced a childhood traumatic experience or event, or even in their adulthood might have experienced some degree of a traumatic experience, and is often known to be used and very effective as well with PTSD. So EMDR, it definitely addresses a wide range of trauma overall. There's a specific phase of EMDR that's called bilateral stimulation. And during that phase, that's where a lot of the reprocessing take place. And pretty much what it is to help to reactivate the memories that's linked around whatever the traumatic experience was, and pretty much help the client to be able to reprocess and work through the way how that memory was stored. Typically, it's stored in a maladaptive way, which might be affecting how they deal today. So maybe certain symptoms might come about, certain behaviors, lack of, and so forth. So we just use that process to really help them to reactivate, restimulate that memory, and reprocess, work through it.
Is there any certain issue that you see that EMDR really works best with what clients are bringing to you? What type of trauma?
I don't know if I would say so much what type of trauma. Sometimes what I would say is a lot of the times, or many times, when clients have experienced some type of a traumatic event, there's some degree of dissociation that takes place. And with that being said, we often try to make sure that the clients are within their window of tolerance. They're not hyper, stimulated where they're not able to tolerate treatment per se. So the idea is to make sure that they are within that window of tolerance prior to engaging in this reprocessing phase. So I would more say that's a huge factor versus one traumatic event per se over another. So dissociation is a very broad definition. To some degree, we all disassociate. I don't know if you ever experienced driving on the road and maybe kind of gazed out for a bit. And it's like you come back through and you're like, where am I? When did I even reach here? So to some degree, that's disassociation a bit more lightly. Now, when it comes to individuals who have experienced trauma, sometimes what happens is it's like they're reliving that particular trauma. They're visualizing, they're seeing, they're feeling, they're smelling, they're sensing themselves being back in that particular event. So once they're not in that reality phase, once they're not in this present phase, is here and now, which is disassociation, then, we try not to. That's not the best time, in other words, to do a reprocessing, because that means that they're out of their window of tolerance. So we try to make sure that they're grounded, they're here, and to pretty much bring them back into the here and now. So dissociation could look, many different ways, look like many different things. But in general, it's more along that lines of making sure they're grounded.
So have you seen in therapy your clients feeling comfortable with that, or how do you introduce your clients to this process?
So a lot of psychoeducation. Sometimes I might provide them with a pamphlet for them to actually look through and see what each of those phases looks like. I might have a mini video for them to see it, see if they have any questions. So prior to jump right in, making sure that I provide them with that information, in which, to be honest with you, in a lot of cases, many clients, they have done their homework. So when they're looking for an EMDR therapist, it's because they're aware of what it looks like. And because it differs a bit from traditional talk therapy, and they feel as if, they would like to try a different type of modality, that's typically what takes place. So psychoeducation is one of my biggest steps before going into that reprocessing phase.
I don't use EMDR. I refer out. And I know for me, I'm used to maybe sometimes clients we call them homework assignments, and they go home and what can you implement to help you practice certain things to help you kind of heal in the moment. So is there anything that you also give your clients to use to implement at home? Is there anything from EMDR that they can also practice being present, or different activities like that?
Yes, and that's one of the reasons why I do adore. I really do like EMDR. Because there are many different modalities, believe it or not, that when it comes to EMDR, it is to a degree is integrated. There's some CBT work, some somatic work, there's so many different things. And one of the things that as a homework assignment, I love to give, because I even have a lot of clients, for example, that might come with anxiety or depression. And after doing some exploration, you could see where it might have been linked to some type of an event that happened, a traumatic event that happened in your life. And, over the years or months or whatever the case is, it just kind of, continue on until they start experiencing these type of symptoms. So I do a lot of relaxation technique, a lot of, body awareness, just being in tune, understanding what's taking place with your body. A lot of relaxation breathing, deep breathing exercises. That's something that I tend to use a lot of, and just being attuned to what's happening in your body. One of the things that I've noticed that with a lot of our clients, we have those that's very logical. They're very, they're thinkers. It's there's so everything they try to analyze and think, and not so much be in tune with what's happening to them physically. And then you have others that might be more emotionally driven, but the logical piece, not really so much. So, it's so important to have that connection. So that's one of the things, again, that I do like to tell them in between sessions. I might give them an assignments, even sometimes even certain type of worksheets where they're able just to kind of be by themselves and just be aware of what's happening, being able to identify that when they're thinking a certain way, how are you feeling in your body? Where are you feeling this in your body? And vice versa. So those are a few assignments that I would tend to assign in between sessions. I actually use this as an example. Just imagine for a second that someone who might have, someone living in an apartment building, and that apartment building, they had a fire. That person, that individual don't know what's going to happen. All they know is that they're in their apartment. They can't get out right now. There's a fire. They're smelling the smoke. They're feeling the heat within their bodies. They're all together. They just, don't know what's happening. So they have that fear that's overtaken them. Needless to say, everything worked out to the point where they're able to leave out of that apartment and they continue on with their life. Now, let's say later on, they were invited to a bonfire, for example, and everything is fine. They're with friends. They're having a really good time. All of a sudden, they notice that they're feeling, this discomfort. They're starting to smell that smoke again. Granted, they're by that bonfire, but at the same time, they're feeling this tension in their body. They're feeling this heat in their body. So there could be certain triggers that happen later on. And what's likely is that experience that they're having around that bonfire, sometimes not even having that connection, is almost like reliving itself within them because of the trigger of being around that fire. It's starting to, because our minds, our bodies, it's so powerful that without even realizing it a lot of the time, again, it has that memory component where, remember this specific event might have happened. So even without a person being aware, it doesn't mean that the body and the mind doesn't remember what took place prior. So sometimes something like that would be a really good example of how your body can relive that physiological response that it might have experienced, a couple months or years ago, just by this little event, what's supposed to be a very, happy go time you're spending with your family and your friends or whatever the case is. But again, your body does remember what happened and it tends to react a certain way. Doesn't happen with everyone, but it definitely is something that does happen with many of our clients.
And it kind of brings me to, if our listeners were kind of, wondering when is a good time to seek therapy, and I'm not sure if I'm ready, but it sounds like, when those triggers become more intense, and when it starts to impact their daily routine, that would be a great time to say, you know what, I'm ready to get this out, to talk to someone.
Exactly. And that's exactly what I would say too. The moment it starts becoming a disruption to your daily life, that would be definitely a great time to start seeing someone, even if it's just a consultation, to reach out and try to receive some assistance at that point. So I do agree with you there. So EMDR consists of 8 phases. The thing about it is, for some, depending on what it is that a person comes to therapy for, it could look a little bit differently. For example, phase 1 is typically the history gathering, almost like your biopsychosocial, but specifically geared towards the targets as to what it is that you do want to treat in the EMDR session. In session 2, phase 2 is more of like preparing the clients for what is to come. What does it really look like to go through all of these phases? So the bilateral, depending on what that looks like for the client, there are different types. So you take in consideration which one the client is more comfortable with. So again, that mostly making sure that they're well-resourced, having a coping mechanism in place. So in between sessions, if they feel a bit agitated or activated, they have a way of dealing with, what it is that they're feeling. Now, phase 3 has to do with assessing the target memory. So this is where you really focus in on what that memory is that you're reprocessing. So it's a bit more structured, and we focus on a memory at a time just to make sure that we're effectively addressing each of, almost like your treatment plan, right? Each specific goal of treatment. And then phase 4 to 7, those phases kind of goes hand in hand. That's where you start processing the memory and try to reinstall a more adaptive, install a more adaptive way of addressing that particular memory. So there's something that's called a negative cognition, and that might be a negative core belief that our clients have of themselves that brought them to therapy. And then we try to install a more positive cognitive belief of what they would actually like to think in that particular situation. So sometimes obviously will be kind of opposite of each other, right? Just to make sure that they're able to, again, that memory to be stored in a more adaptive manner. And 8.4 has to do with reevaluating the treatment results and just make sure that it was an effective treatment altogether. So even though it's 8 phases, it doesn't always go like 1 session, 2 sessions, 3 sessions. Sometimes a person might be stuck in phase 2, the preparation for a long time, depending on if there was some type of dissociation and they're just outside of that window of tolerance that we spoke about. So we want to make sure that they're okay and they're able to continue on with treatment, because obviously we want to help them to get through the entire process. So each phase could take longer. Some, it might be, 1, 2, 3, 4 type thing, but it really depends on the severity, the complexity of the case. So, a lot of the time when people hear that term trauma, they think of, maybe someone that might be assaulted or PTSD. And obviously, yes, those are definitely traumatic events or situations that a person might have gone through. But what about situations where maybe someone that, as a child being in school, they might have been bullied? Some people think that that's just a natural part of growing up, in which, yes, I do agree, many students experience bullying, but depending on the individual, depending on how they process that experience, it definitely can affect them in their adulthood. Because of that, then yes, that bullying could have been a traumatic event for them, right? So anything that you might have experienced that affect your daily functioning, and you have a difficult time to either cope with or to address effectively in your adulthood, could have been a traumatic event. So trauma is packaged in many, many different shapes, sizes, and forms. And the thing about it, which makes it so unique, what might be traumatic to me might not be traumatic to you. Maybe I was more of a sensitive person, more emotional, whereas maybe that wasn't your case growing up. So the way how I dealt with certain situation, it was just more of a traumatic experience altogether for me. So it really depends on whom we're speaking about and how they might have internalized that experience. And that could definitely affect the way how they deal with the situation later on in life. So to answer your question about a big T and a small t, a big T has to do with those more, a bigger type of traumatic events, like we spoke about, maybe PTSD, maybe, someone that might have been sexually assaulted, certain experiences that tend to be more traumatic, versus something that, yes, it was a traumatic experience, but it might not have reaped that result, or it might not have been as traumatic as, something more bigger, like what we just mentioned.
And your empathy comes off so well, and you seem so comfortable with this process, and I can see how clients can be really comfortable with you. Is there anything you would share with listeners of what questions they need to ask providers to help them know if that's a good fit that they're going into the counseling session?
In terms of one of the first thing is really, I do believe that when it comes to our therapeutic relationships with our client and therapist client, right? It's so important for that relationship to be a good fit, and sometimes I'm sure you hear it and clients have mentioned it and so forth, that they might not, a person's style might be a little bit different from how that person or client is. Because even with EMDR, we have many different approaches. And one of the things that I would say is, like, for some EMDR therapists, they might have a different function in terms of maybe integrating a different type of a modality as well. Sometimes you'll see that. And sometimes they might specialize in a specific area of EMDR. So maybe identifying what area that therapist specializes in, and depending on what it is that you are experiencing, seeing if it makes sense. Because you do have some, for example, that maybe they specialize in attachment, or dissociation, or just childhood trauma. So there's different specialities even under the umbrella of EMDR. So depending on what it is that you're experiencing, I think it's good to also know what it is that your therapist specializes in. And that would be a good way to start knowing if that's a good fit.
Is there anything else that you want to share with our listeners, or anything that you feel is important for them to know?
Well, I mean, for the most part, we're there to help. That's our job. And sometimes I feel like for some of our clients or for someone that might be on the fence, not sure if they should or shouldn't, um, just a simple fact of being on that fence. Why are you on that fence? There might be something that's affecting you. There might be something that's causing you to think that maybe, I need to speak with someone further, and it doesn't hurt to do so. So just a simple idea that you might be entertaining that idea or that thought about moving forward, it's okay to do so. And it's okay for you to feel better. It's okay for you to make sure that you're in a good place in your life. And another analogy I love to give is, for many of our listeners, they might be caregivers, having kids, maybe taking care of their parents, might even be having family members or dealing with families and so forth and so forth. But when you're on a plane and we're getting ready to take off, one of the things that they start talking about is, in the case of an emergency and that face mask, that oxygen mask dropped down, the first person they say to put it on is who? To put it on yourself. Because in order to you to be the best version and to be in your best health, you need to make sure that you're okay before you could do so for someone else. So it's okay to think about yourself and just, provide whatever is needed in order for you to be that best version of yourself. So don't hesitate to seek help if you feel that's something that you'd benefit from.
Well, you've shared so much great information, and this is really great for our listeners to hear and to feel comfortable about taking the next step for themselves. So we thank you so much for, sharing this time with us and with our listeners. And we want to thank our listeners for taking this time to listen with us, and we'll meet you back here.
Thank you so much for joining us here today on the Counseling Podcast with Dr. Jaclyn and Dr. Stokes. Please take this time to thank yourself for putting in the work. If this episode impacted you in any way, let us know with a loving and honest review. If you have any questions or want to continue the conversation from today, you can reach out to us at thecounselingpodcast@gmail.com, and we can answer your questions right here on the show. Or you can find Dr. Jaclyn and Dr. Stokes on Instagram at DocJaclyn and at dr.jeremiah.stokes.